Hello wonderful students. So in this video we're going to look at the topic varicella or chickenpox, which is produced by the human herpes virus 3, and remember it is also called as varicella zoster virus. It belongs to the human herpes virus 3 and it is herpes viridae family. It is a DNA virus and it can produce two clinical features. So the primary infection is called as varicella or chickenpox, and this is going to stay latent in the dorsal root ganglion, and if it gets reactivated, the presentation is called as herpes zoster or shingles. If you want me to make a video on herpes zoster or shingles, in the comments write down HZ. Okay, so coming to the clinical features of the varicella, so it is going to affect mainly the children, and the incubation period is 2 to 3 weeks, and there can be prodromal symptoms 1 to 2 days before the onset of the rash. The children can have fever, arthralgia, myalgia, body pains, malaise, and so all these symptoms will be there when the rash develops. Remember, the rash is going to be seen over the face and the trunk, and it is going to be mainly focused in the centripetal areas, that is, we can say the trunk and the proximal extremities. So this distribution is called as centripetal distribution, and of course mucosa can also be affected. And what are the lesions which we are going to see classically in the patients of the varicella or chickenpox? The rash is classically vesicular. Vesicular is fluid filled rash, but yes, there can be maculopapular rash initially. So these macules will become papules, and papules will become the vesicles, vesicles will become pustules, and ultimately they are going to form crusting. So in a given patient, you can see that all the stages of these rashes can be seen at a given point of time, and this is what is called as a pleomorphic rash. Pleomorphic rash, where all the lesions can be present simultaneously, and the lesions in the varicella, they are going to appear, new lesions appear over 2 to 4 days in the crops. So these terms which I am telling you, they are very important. The crops, pleomorphic rash, so you should write them down and you should underline them. Okay, and here you are able to see in the picture there are papules, there are vesicles, and there are ulcerations also. And remember to write down one more buzzword related to varicella. The rash is described as dewdrop on rose petal appearance. So if you see the picture, you are able to see the skin is a red, and on the top of that there is this shiny fluid filled blister looking like a dewdrop on rose petal. So that is the reason why it is described as dewdrop on rose petal appearance. Lesions usually heal without any scarring, but if there is a secondary bacterial infection due to staph or strep, then there can be a possibility of scarring. Diagnosis is mostly clinical, and if you need to confirm, then you can do culture or you can try to check for antibody titers and do a PCR. And there is investigation in microbiology which is called as Zangsmeer. I have made a video on this. I will leave it in the iCard. So in the Zangsmeer, we are going to see multinucleated germ cells in the patients of the varicella chickenpox. If this video was helpful, please do hit that like button. Students, do not forget, yeah, please do hit that like button. Coming to the treatment, supportive treatment is what is recommended. So bed rest and antipyretics, antiviral agents, acyclovir, valcyclovir can be given, antibiotics if there is bacterial infection, and remember to write down the other systems which are going to be affected. So the patients can have CNS involvement in the form of the meningitis, encephalitis, transverse myelitis, GBS, Guillain-Barré syndrome, and cerebellar ataxia. Other organs can also be affected. Lungs can become affected, pneumonia. There can be inflammation of the heart, inflammation of the kidneys, inflammation of the liver and joints. And I hope all of you know Rice syndrome. If a child is having a viral infection and if we give aspirin, there can be hepatic encephalopathy which can develop. This is called as Rice syndrome. It is very serious complication which we need to be aware of. So in any children, do not give aspirin. Okay, it can lead to Rice syndrome. So I hope this video was helpful. If it was helpful, please do hit that like button, and also remember students to share this video among your friends and do group discussion. do discuss, and you can read from these books. These are the source which from which you can read this. And if you want me to make a video on the next topic, which is the genital herpes simplex, you can write down HSV in the comment section. So that's it in this video. So I hope you have hit that like button. Also, if you have not yet subscribed to this channel, please do subscribe to this channel, and in the comments write down thank you if this video was helpful. Thank you so much, dear students. We'll meet in the next video. Till then, happy learning. Sarvam Sri Krishna Arpanam. Sarve Jana Sukhino Bhavantu. Bye bye.